2016 has been a great year for FX Medicine. We've celebrated the first anniversary of our dedicated website, fxmedicine.com.au. And we're also very honoured and proud to be the recipients of the Complementary Medicines Australia CMA Award for Most Outstanding Contribution to Research, Education and Training. We love bringing you relevant content which is designed to improve safety and clinical proficiency. We're so very grateful for your continued support, and please do let us know what topics you'd like us to cover in the future by dropping us a line on fxmedicine.com.au, Twitter or Facebook. This is FX Medicine. I'm Andrew Whitfield Cook. Joining me on the line today is Beth Bundy, who's a qualified naturopath of 17 years specialising in integrative and functional medicine. Beth has worked previously as technical consultant at Pathlab, one of Australia's original functional pathology companies, and is currently training health practitioners nationally as clinical consultant at Neurotransmitters Integrative Pathology Services, where she is in high demand as an engaging, informative speaker. And I really mean that. And she also works as a functional medicine practitioner in a busy and highly successful integrative medical practice. Beth, welcome so warmly back to FX Medicine once again. How are you, dear?
I'm back.
I do love you. You have the most joie de vivre of any of my my podcast interviewees.
Oh, well, thank you. I didn't know you spoke German.
Well, being a blonde. For our listeners, we were talking about this earlier. Beth is not a blonde.
Yes. For those of you who thought I sounded like one, I am not blonde. Yes.
So, Beth, today we're going to be talking about something which, I've got to say, I was a little bit sceptical of. It's neurotransmitter testing. But I think there's real facility here because of the real issues with anybody treating anything from a psychological basis, hoping to change neurotransmitters inside the brain. What is the test and what does it test for?
Alrighty. So first we have to think about what are neurotransmitters, and we know that they're chemical messengers of the nervous system, and testing has actually been around since the 1950s. So
wow.
This is not something new.
Huh.
And so these neurotransmitters operate as chemical messengers, and they regulate our cognition, memory, emotions, respiration, heart rate, digestion, blood pressure, and hormonal responses. And there have been imbalances of these have been implicated in things such as Parkinson's, Alzheimer's, and Tourette's. So it's definitely, they're a big part of whether they're excess or deficient. And they probably relate more to general healthcare practitioners in the depression and anxiety aspect. Now, talking about, there's been a bit of talk about them that they can't pass the blood-brain barrier, but they've actually found specialised cells called brain capillary endothelial cells that they actually act as little transporters and pass and get the neurotransmitters to go in and out of the central nervous system.
Oh.
So they can go floating about, and neurotransmitters can be found in blood, cerebral spinal fluid, saliva and urine. And so obviously the neurotransmitters circulating in the blood are then filtered by the kidneys and then excreted in the urine. So in this sense, we can measure these as a biomarker of, the nervous system function or the whole body neurotransmitter metabolism.
Right.
And studies on rats have shown that they correlate well with central nervous system neurotransmitters.
Oh.
And mainly they had to test central nervous system tissue, which they had to perform in non-human subjects, obviously for ethical reasons. So that's why it is difficult with some of the human studies to make absolute comparisons, because just people haven't done too much of chopping up brains while people are still talking.
Or lumbar punctures and things like that. Yeah, that's right.
Yeah. Well, that's the whole thing too. A lumbar puncture or spinal tap is a little bit more invasive and difficult to do at home.
Ooh.
So,
difficult to do at home. I'll just back up to this drill bit. Do not do that at home, listeners. Do not do that at home. Oh, my goodness.
It's much easier.
I mean, look, it's not a pleasant test, a lumbar puncture for any reason, even dire. Very uncomfortable, and should only be done by an expert, suitably trained medical professional.
Yes, let's have a disclaimer there.
But are we testing for the actual neurotransmitters or the metabolites of such?
We can do both. So the biggies that most people would know are, we have the inhibitory neurotransmitters, which is serotonin and GABA, which people would have heard of, and the excitatory ones, dopamine, noradrenaline, adrenaline, and glutamate. So glutamate, which we can test as glutamate, is the brain's major excitatory neurotransmitter. Is involved in memory and numerous other things. And excess levels of this is seen as neuroexcitotoxic, which is not good, and has been associated with things like autism, stroke, and Alzheimer's. Dopamine is our reward and pleasure centre in the brain, as well as other things. And many would know its role in motor function and its relation to Parkinson's disease. And then we can measure two metabolites of dopamine, which is DOPAC, or dihydroxyphenylacetic acid, and homovanillic acid. So they can be measured quite clearly in the urine.
Yeah.
Adrenaline, or for those in the States, epinephrine, which is predominantly made by the adrenal gland, but still some in the nervous system, and noradrenaline, or again, for our US listeners, norepinephrine, which is made in the adrenals and the sympathetic nervous system. So these two regulate your fight or flight. You know, they increase your focus, alertness, memory, heart rate, blood pressure when you're going to run away from the lumbar puncture. So, and then we can also measure metabolites of these called normetanephrine, which is a noradrenaline metabolite, and vanillamandelic acid, which is a noradrenaline metabolite.
Right.
So that's, so they are definitely the metabolites of those hormones.
Yep.
Then serotonin, which is our happy hormone, which regulates our mood and our appetite and our sleep. We can measure it as well as its metabolite, 5-HIAA, in the urine. GABA, or gamma-aminobutyric acid, which is the brain's major inhibitory neurotransmitter. Then we can also measure other aspects, because amino acids are very related to our neurotransmitters, because they're the precursors to them.
Yeah, monoamines,
Absolutely. And so some other things we can look at is glycine, which has been shown to help sleep and used adjunctly to schizophrenic treatment. Mm-hmm. So medication for schizophrenia to some good avail. And then a new one we can look at is PEA, or phenylethylamine.
It's ice cream.
Ice cream?
Ice cream. PEA, isn't it? Phenylethylamine.
It's in ice cream.
I thought so.
Is it? Yeah. Oh, well, that's good for the ADHD kiddies,
because
it's a good biomarker for ADHD, and so low levels have been seen in our ADD kids versus controls. And another interesting thing is PEA levels have been seen to increase markedly after skydiving. So I thought perhaps, one of their treatment plans could be to push these kids out of planes instead of putting them on Ritalin. She says with her tongue firmly in her cheek, please don't write to Andrew and say I'm doing horrible things to children. But also maybe we could just get them to run around more, because just increasing physical exercise can increase PEA levels.
Right.
So, maybe the kids need to get off the computers and out into the sunshine again, which is would be nice for all the kids and the mothers.
Oh, indeed. Now, I have to ask, though, you mentioned glycine before. Surely that's going to be prone to dietary aberration or influenced by dietary intake. So where do you measure glycine? What are the issues here?
Well, like with all the amino acids, I would actually preferentially measure them in the blood.
Uh-huh.
They can be measured in the urine as well. And yes, when we are testing neurotransmitters, there are some restrictions with what you have to avoid in the food department before you do the test, because it can give false positives.
Yep.
So that's, things like bananas, avocados, nuts, nut butters, things like that.
Okay. So,
good old coffee, tea, of course, MSG, because it's got a high glutamate, aspartame, your pretend sugars.
Okay, but I guess where I'm going there is surely there's other things that might impact on the excretion of those chemicals and hence confound the results. Is that right?
Well, to a point, yes, because most of the organs in the body are capable of synthesizing as well as degrading one or more of the neurotransmitters, especially true in the gut, where we have the cells called enterochromaffin cells,
yep,
which serve as a primary site for almost up to 90% of serotonin production, storage and release. So here, serotonin definitely plays a strong role in the nervous system, activating reflexes associated with intestinal secretion and motility. And we already know that some neurotransmitters are produced in the brain and taken across the blood-brain barrier. Others produced in the periphery, like your adrenaline and noradrenaline in the adrenals. And then the kidneys filter this into the blood. So definitely urinary measurements have been shown to correlate well with things like glutamate and PEA. And for others, what ends up in the urine is only reflective of peripheral, production, things like your serotonin and dopamine. But, again, regardless of where they're produced, all these levels are, indicative of altered neurotransmitter metabolism. And it really is, like we said before, is the best option that is non-invasive and easy to do at home. Versus the lumbar puncture or open brain surgery to extract them. Yeah. But always, as we always say, Andrew, it's ultimately we need to reinforce with the practitioners the importance of interpreting the values with the patient history and not just following numbers on the page.
No, that's right. I'm a big fan that a test should not control your treatment. Guide it, certainly, but not control it.
Yeah, and the other thing we have to think about, it's similar for any lab test, well, many lab tests, I should say. It's not always completely diagnostic for any particular condition or disease. So, like, if we're doing LFTs or, our liver enzymes, having an elevated liver enzyme is not diagnostic. It's just something that we need to go and look into, such as if we have low ferritin, it just directs us that we have to go and look into depth, more testing or other things, so then we can diagnose a particular situation. So it's really, we're looking at a snapshot.
Yes. A
snapshot of where someone's at in the best ability that we have.
So there too, to my next question, if you're going to take a snapshot, what about diurnal variation? Indeed, you get swapping of neurotransmitters during the night time when you're preparing for sleep. So how do the metabolites mimic these diurnal and nocturnal variations?
Well, again, we generally do it during the day,
right?
As a one-off. You can do it top and tail of the day. That is possible, but of course, we also have to be mindful of the cost of these things for our patients as well. But yes, certainly you could do them 4 times across the day if you wanted to and look at that.
Yeah.
It's really up to, how keen you are to find some rhythm and how keen the patient is to keep weeing on a stick and can afford to pay for it. But that's why, again, it's the same as if you do a cortisol in the blood.
Yeah, that's what I was thinking of.
You could do it. Yeah, you could do it every 10 minutes and you'd get a different reading as it moved across the day. And plus the other things is, people get stressed out, and we know that stress in people, as it does with animals, is going to fly up our neurotransmitters. So it's always, and that's the good thing about people being able to do, because it's a urine test, obviously, at home, is that it's a little bit more relaxing than having to front up into a clinic and with the bright lights and having to perform a test.
Yeah.
So, we just have to use it with our patient's history and with other tests. So this is the other thing, is I really don't believe it is a standalone test.
Aha, good.
Yeah. So I would need to test, depending, of course, on the presentation of the client.
Yeah.
That is always first and foremost.
Yeah, but good practical information. That's good.
Absolutely. And you'd also be looking at, maybe some methylation pathways issues. So maybe, where your SAMI and your SAR, which we've talked about on previous podcasts, SAMI and SAR levels, histamine levels, amino acids, of course, could be a problem, along with the hormones, cortisol, thyroid hormones, the sex hormones. They all play a part. They're all in the big bucket of what's going on in this person's head.
Yeah.
An example of how amino acids can affect someone is I had a young lady who was a very strict vegan and was also into self-harming. And the benefit of this test, and I did her adrenals and I did her hormones and I did do neurotransmitters because she was not on medication, and being able to show her that her levels of neurotransmitters were so low, I was able to explain to her the need for amino acids, the need for protein, and was at least able to get her onto a vegetable-based protein.
Yeah.
But it made such a difference. I mean, the first thing she stopped doing was hurting herself.
Interesting.
Yeah, and I really believe it was to be able to show her, and then obviously give her other things apart from the protein.
Yeah.
But that was to give her the amino acids in a more concentrated form so she could make these neurotransmitters, because that's the most important thing, is the amino acids to be the precursors along with our other nutrients along the way, and our magnesiums and our B12s and essential fatty acids and the like.
So you've partly answered my next question, but I was going to ask what the clinical significance of the tests. Has there been any research done on them?
Absolutely. So, and it's certainly, I just wanted to say that it's apart from actually I've had 2 strict vegans that this has been helpful for. To actually, and another practitioner was telling me about a patient that we did this test on, and the dopamine was out of control and on the levels, and so we were able to gauge from this that the patient was actually either overprescribed or taking excess tablets.
Right.
And so that was great. She was able to send him back to the doctor and say, hey, look what he's doing. And it turned out he was taking too many of them.
Gotcha.
So, so that was kind of helpful.
Oh, so that's a good facility actually, isn't it?
Yeah. And it correlates very well with they actually use it in some places to help assess patient compliance.
Yeah.
Because Parkinson's people, may not remember their medication as well as they should. So it can actually determine patient compliance and avoid the overdosage. And another thing they were able to show too was that low levels of 5-HIAA, which is a serotonin metabolite, they actually showed that in Parkinson patients that they had the highest degree of depression or dementia.
Right.
So they were able to, determine that from the levels of the serotonin metabolite. The other thing that we can look at is that autistic children, so kids on the spectrum have been found to have low levels of urinary dopamine and high levels of noradrenaline. Okay, and in one study, they actually found that, again, kids with ADHD, they found that the noradrenaline levels positively correlated with the degree of hyperactivity in these kids.
Okay.
And that pycnogenol, so our pine bark extract, could help decrease the noradrenaline and adrenaline levels and leading to less hyperactivity in the kiddies, which is, fantastic.
Yeah, absolutely.
Yeah.
So they're your previous diagnoses that patients have got, if you like.
Yes.
Are there any other symptoms where you might think to trigger or, to sort of pique your interest to say, maybe we might test your neurotransmitters? Not yet a diagnostic box, dare I say that word?
Yes. I was actually looking up some stats for today's podcast, and Beyond Blue, which is a mental health,
a fantastic mental health support organisation,
institution that helps help people with mental health issues, and by their reckoning, 45% of Australians will experience a mental health condition during their lifetime.
Yeah.
Which is frightening. That's like nearly half of us.
Oh, yeah.
And they reckon 14% suffer from anxiety disorders, panic attacks, OCD, post-traumatic stress, or general anxiety disorders, and 6% from depression. And, in the US, mood disorders are the third most common cause of hospitalisation in people aged 18 to 44. Yeah. I was like, what the? And the top prescribed and top-selling prescription drugs in the US is antipsychotics, antidepressants, and ADD drugs.
Wow.
Yeah, where in Australia, I was trying to compare Australia, but we're not so into that. We actually are loving our statins and antihypertensives here.
Yeah, it'd be heart drugs,
But I thought that was quite interesting too, that, we're similar countries in many ways, and our stats for anxiety and depression are very similar. Yet they're quaffing them way more than we are. So I think, this is where that thing about, the current treatment protocols like you were talking about is relying on clinical signs and symptoms, and we're trialling pharmaceutical treatments that, and some are effective for people. But then sometimes they're on them for too long and, they have relapses or it's not just doing what it used to. And so I think this can be helpful for those people as well. And I know they've already had a diagnosis. And again, we've got to remember this is not a diagnostic test. But conditions I would consider doing this for is obviously if someone comes, they haven't been diagnosed with a depressive or an anxiety disorder, but they come to you complaining of depressive symptoms or anxiousness. Migraines is another thing that we can look at. Insomnia, menopause, PMS and the PMD, the depressive sort of PMS.
Yep.
And again, things like autism and ADD that, again, has already been diagnosed, but it certainly can help with what therapy they're on. Or, I get a lot of people in practice that don't want to be, they've been offered antidepressants and they don't necessarily want that. And, sometimes that's like, say menopausal women, we know that their estrogen levels are affected. Yeah. And they are using SSRIs and SNRIs.
Hot flushes.
As alternatives to estrogen therapy in the treatment of hot flushes. But studies have also found that, increased serotonin levels happen naturally in menopause women. And they've postulated that maybe this is a compensatory mechanism for the lower E2.
Right.
So it could be that these ladies, this is why the antidepressants work, is because it's augmenting serotonin levels, where they're not having the estrogen. And the same as this with our PMS or our PMD girls, they can see that they may have low serotonin and elevated noradrenaline levels.
Yeah.
And as the serotonin levels are improved, the noradrenaline can relax a bit and come back into balance. And then so these ladies can feel better. Now, some of them still may need some medication, but generally we find if we can augment that serotonin, that they either can have less medication or at least the medication they're on is more effective.
Yeah.
You know,
one of the areas that I'm wondering about the facility of this test is to maintain compliance on, let's say, a medicine. Let's say it's an antidepressant, where or even antipsychotic medication, where you have what's called the revolving door syndrome. It's a very common syndrome with psychiatric conditions, and that is where people take their meds, feel well, or don't like the side effects of them, and then eventually go off them. And so therefore they get sick again, and then they go Florida, get put on the meds, blah, blah, blah. So because it's so prevalent that a lot of people feel horrible on antidepressant medication and therefore cease them, thereby putting themselves at risk again, wouldn't it be interesting to be able to guide therapy to put them on a minimal dose that's still maintaining the, satisfactorily controlling their symptoms, but being on a minimum dose so they don't get the side effects?
Yeah, well, that's a possibility too. I've found that because you can do these tests with people on medication.
That's very interesting.
And I've found that, interestingly, now this is especially with people that have been on medication for quite a long time. And this might be that they do not have a serious case like you're talking about, a serious psychiatric case, but they may have been popped on, like I had a patient recently, she was on an antidepressant, and I can't remember which one, but she was on one. And she was on that. She was popped on that when her mother died. Now, her mother had passed away 8 years previously. And so I did say, and so how long are you intending to stay on this if you were just put on that for a grieving process? Is there something that we can look at to help you not need that tablet? Because also she's complaining that it's not working. And so the only answer when they go to the doctor and say it's not working is to either increase the dose or try another medication.
Yeah.
Now, I've definitely, with her, have done a neurotransmitter test. And when we look at it, her serotonin levels are still really low and her noradrenaline levels are high.
Yeah.
So rather than saying, oh, yeah, girlfriend, you need some more, drugs, I'm thinking when you've been on it for a long time, and if they in fact are not, they're not making serotonin, we must remember, they're helping us recycle what we've got.
Yeah.
So if you haven't got very much in the first place, what the hell are you recycling?
Yeah, that's right.
So it comes to a point that it is like lolly water and it's not necessarily doing what it was intended to do.
Yeah,
so
that's right.
This is where I find it helpful. Yeah, well, I don't know if your meds are really, hitting the spot, girlfriend. So let's look at other aspects. Let's look at your lifestyle. Let's look at your diet,
your gut.
And your gut, exactly. All of the above. Let's look at all of that stuff, because I have definitely been able to get numerous people off medication or greatly reduced doses and generally feeling better. Now, this is not just from a neurotransmitter test, again, especially with our ladies. I'd be looking at their hormones. And indeed, in our older gentlemen, I would also be looking at their testosterone, because we know for a fact that estrogen and progesterone levels will affect, the women, and low testosterone levels are depressive for a man.
Yeah.
So, everyone knows a grumpy old man, and it's not just because he's living with a cranky old lady, but it is because the testosterone affects them as well. So this is where it all needs to come together. This is great for people that have been on meds, in my experience, people that have been on meds for a long time and not feeling good, or they want to come off them. And, of course, that is always with respect to the degree of the condition in the patient.
Yes, I was just catching myself what I said before. And I wanted to add in there for our listeners, any representation of serious symptomatology, particularly in psychiatric patients, obviously, must be appropriately referred, and especially those who have had a history of suicidal ideation. So I just wanted to put that in there as a I'm thinking representation of psychotic symptoms and representation of suicidal ideation. Any sort of alert symptoms that you trigger that you sort of pick up on must be appropriately referred to a medical practitioner. So.
Indeed, and even I work with a medical practitioner, and we have people that we won't even. It's like, no, you really need to go and see a psychiatrist, or you really need to go back to a hospital, because they're even beyond, that level of care too.
Yeah, but that's what I love about you, Beth. You're safe in your prescribing and your care. I've got to ask though, when you're talking about a urinary test, so this is a do-at-home test. You're then opening up user error when doing the test. So how is the test done, and who sends it to the lab, and then who gets the results? We don't want the patient getting the results, right?
Oh, please no.
No.
Please no. That is I usually ask all my practitioners to please don't let your patients have a copy of the test before you've spoken to them, because, Dr. Google can answer all their questions and make
wrongly.
Oh my goodness! Open a whole can of worms.
Yeah.
So no. So it is a wee test they do at home. The most important thing with any self-test is read the instructions. Please, I actually go through the test with my clients.
Yep.
Because especially if they're depressed or anxious, they've got foggy brains. They're not thinking quite clearly.
Yep.
So I go through it with them. I show them, we do a little puppet show of what they do, So that's quite cool. And then I again reiterate that they're to read the instructions, because, as I said, it's important for them to be avoiding particular foods on the day of the test and the day before. And preferably off any other supplements, and I mean nutritional supplements, that may affect the test, just like being on zinc and B6 will affect your cryptopyrrole testing. We need to make sure that you're not on amino acids and you're not on 5-HTP or you're not on St. John's, any of those sorts of things. Except now, if they're on medication, do not take your patient off medication to do this test.
Right.
You do not play with that sort of medication in people, right? They can't just not do it for a couple of days. So that's another disclaimer, is if they're on prescribed medication, they stay on that.
Yep.
But if it's nutritional supplementation, herbal supplementation, we can
control,
restrict that.
Yep.
Yeah, we can restrict that.
Yep.
And then the other thing that's important, being a urine test, this test is assuming we have proper kidney function.
Right, of course,
so,
yes.
Yeah. So
I was thinking about this when you were talking about glycine. I'm thinking diabetics and, protein leakage and things like that.
Yes, so we're presuming, so a creatinine level is done to make sure, we're measuring apples and apples.
Mm-hmm.
But so certainly if someone has some kidney issues, then that is what you do. But definitely it's a wee test. You take it home, you package it up, you pop it into the envelope that gets sent to the lab. It really is very easy.
Yep.
It's no need nowadays to do a 24-hour collection.
So forgive me, so does the patient bring the wee test back into the practitioner and the practitioner send it off to the lab, or does the patient take the test home and the patient sends it off?
No, usually labs will give you a kit that has got all, everything needed in it.
Gotcha.
So the patient can do it at home. There's usually a prepaid envelope that they send back to the lab with the urine specimen in it.
Gotcha.
Yeah, so that's why it is quite easy. And then the practitioner will get the results emailed to them, and then they can have a look at them and before they get the client in to go through. And it's quite the results that Naturopath give is actually quite extensive. There's actually a questionnaire in the kit as well that the patient is asked to fill out.
Yep.
And then the report does reflect back some of the things that the patient has reported in the questionnaire back in the report. So it is quite comprehensive.
So that might be worthwhile, the practitioner going through those questions with the patient in the clinic, yeah?
Yeah, well, there's sort of things that it will come up in the report. It will actually say, your patient said this, blah, blah, blah. And so then you can certainly go into that with the patient. Oh, you didn't mention that you had headaches, but I see here you've mentioned headaches here. Tell me more about that.
Gotcha,
So,
yeah.
It can certainly be helpful with that. And
so that again answers part of my next question, which was about guiding therapy. You'd need 2 tests minimum, right?
Yes, because again, it's like with anything else. Otherwise, when we just go off symptoms, it is very subjective.
Yeah.
It's what the patient thinks is, how many ladies have practitioners seen when you talk about their periods and you say, what are they like? And you go, normal, I have the pain and the discomfort and the heavy bleeding and the this and that. And you go, whoa. That's not necessarily normal. Common and normal are not necessarily the same thing. So what one person finds anxiety producing, another person might, laugh at, or, the same as with depressive symptoms, so that's why I think it's quite subjective. So if you take on symptoms and a clinical picture as well as some testing, we can get a bit more oomph in what we're looking at.
Okay, but when would you, as a practitioner, not do the test?
I would not do it. As I said before, I certainly wouldn't bother doing it as a standalone.
Yeah.
Because I don't think that's ultimately super helpful. And I would be very careful and question whether I would do it with a patient who is on numerous mental health drugs, because then I think it's very difficult to get a good picture when they're on so many things. I mean, I have a patient in mind, and they are on, so many drugs that even they wonder how they can stand upright and function. And really, when you look at the thing, you go, oh my God, how come you're not just lying in bed comatose? So we have decided that we will not test in this instance, because there's too many confounding issues, because there's too many drugs in the picture. So we're looking around that and looking at general health and general help otherwise, and to possibly reduce some of the medication she's on before we measure.
Right.
So that would be something I'd be, well, hang on, they might be in a too hard basket for, standard health practitioners. And that's probably the only time I wouldn't, is if they're on a lot of medication or that's the only test I'm doing.
Yeah. I think it's got broad facility, much more than what I thought originally, I've got to say, and particularly in guiding safe therapy that's beneficial for the patient. I think this is got real benefit there. Is there anything else we need to know about neurotransmitter testing, Beth?
No, I think we've probably covered it. Again, I just want to reiterate yet again about, we can help patients when they're on, antidepressant medications, because we can augment that with, such as amino acid therapy, or using things like our L-theanine or our SAMI, and as I mentioned before, our nutrients, magnesium, zinc, phosphatidylserine, things like that. And of course, we have wonderful herbs such as St. John's and Carver and saffron.
Yep.
Along with our nervines, withanias and lemon balms and stuff like that. But of course, we have to be careful when we're working with some of those herbs, not necessarily the nutrients, but the herbs with people on medication, because we know that St. John's can affect SSRIs, and Carver people on benzodiazepines, because they can potentiate these drugs. So we do need to add a disclaimer, another, do not try this at home with using that unless they're under a care of a healthcare practitioner.
Yep.
And certainly the nutritional things, so our vitamins and our amino acids can certainly augment people that are on medication. It can decrease their side effects. It can minimise their dosages, which ultimately, again, with the people that I see, they're not necessarily happy about being on the drug, but sometimes they're scared to come off.
Oh, yes.
And so this can be helpful in that, showing them, well, look, you're on this stuff, but it's not really, your serotonin levels are still in the toilet.
Mm-hmm.
So if we augment that, perhaps then you can reduce your dose and you can see that we can wean you off these successfully.
Yeah.
Again, depending on what level of mental health issue we are talking.
Yeah.
So that's always important.
Yeah.
But otherwise, I think it's definitely a fabulous adjunct to some of those conditions we've talked about. Our depression, anxiety, insomnia, migraine, autism spectrum, ADD kiddies, Parkinson's, things like that. I think it's definitely that, along with cortisol testing. I would certainly, again, as a minimum, not do it without a cortisol, adrenal test.
Yep.
Because they're so interwoven with how they work.
I think
with our hormones.
It's got much broader facility than what I originally thought, I've got to say. Beth, thank you so much for taking us through the relevant issues with regards to neurotransmitter testing. I'm imagining that there would be a whole practitioner support sort of material kit to teach practitioners about this. Is that right?
Absolutely. I'm putting together a training program as we speak on various things, neurotransmitters being one of them, just because this is a huge topic.
Yeah, huge.
It's a huge topic, and it's really not doing it justice even in our little chitty chat today. So
yeah, that's right. Tip of the iceberg.
So anybody can contact me, if they want to know more.
Beth, once again, thank you so much for taking us through the facility of neurotransmitter testing and indeed imparting your professionalism when caring for patients. I really do applaud you. Thanks so much for joining us on FX Medicine today.
Oh, thanks, Andrew. Always an absolute pleasure speaking with you.
This is FX Medicine, and I'm Andrew Whitfield Cook. If you've enjoyed what you've heard today on FX Medicine, please engage with us and let us know what further topics you'd like us to cover. You can get in contact with us through our website, fxmedicine.com.au, or look for FX Medicine in your favourite social media platform. You can also rate and review us on iTunes, and we'd really like to thank those who have already rated us. It's through your continued support that enables us to bring you current, complex and relevant topics to enhance your practice of natural medicine.